Dental health is really important because the mouth is the entry point of nutrition in our bodies. And if it is not functioning properly, then we run the risk of not getting the correct nutrition. Actually, we refer more so to oral health these days than dental health. If we have bad teeth that impair our ability to chew properly, then we will tend to keep away from certain food groups that could be challenging to chew. People with bad oral hygiene, people who use and eat and drink a lot of sweets, you can have decay, and you can also have, along with it, periodontal gum disease. You know, the big one that jump out at me is periodontal disease, gum disease. That is when the gum begin to be bleedy, sore, puffy, and just generally uncomfortable. It carries some social consequences, bad breath, and you tend to lose self-confidence. It's so important to have a consultation with your dental personnel, whether the dental surgeon or the hygienist, who would be able to diagnose the needed treatment for such a condition. All sugars are bad, but everything is in moderation. The Jamaica Dental Association endorsed the efforts of the government in reducing the levels of sugar in the bottled beverages. The aim is to get it to 2.5 milligrams in 100 mils by the year 2023. It would be roughly 2.5 teaspoonful. The current level that the government has aimed for, and it was introduced the end of January, is 5 milligrams per 100 mils. So that is coming from 6.5, so it's a gradual reduction. And the taste will be not so significantly different. As a dentist, I recommend the soft, but I'm aware that a lot of patients tend towards the harder ones. It does some damage by cutting a little line at the neck of the teeth, just where the teeth meet the gum line. So we recommend the soft toothbrush. It's really important to begin by putting the brush on the gum. A lot of people avoid the gum because they tend to think that it makes the gum bleedy. It's the exact opposite. It is as a result of not brushing the gum why there is some amount of bleediness. And you should brush in the direction of growth. The top ones, you brush them down in a circular motion, and the bottom ones, you brush them up, covering all surfaces. Don't forget your tongue and, as I said before, the gum itself. Flossing is very, very important. If you try to imagine that the toothbrush does not get between the teeth, the only thing that can remove the material that will accumulate between the teeth would be the dental floss. The technique is also important. Hold it short, get it past that little tight area, and gently bring it down into the gum, that little crevice of the gum, and remove it. Remove material that might have accumulated there. And we recommend 6 monthly checkup. If you tend to be prone to decays, we would really like to see you every 6 months. If you have been checked and you are pretty much okay, a yearly visit would be adequate. Extraction really is the last resort. With regular examination, we can pick up, using x-rays and visual examination, early decays, and these can be effectively dealt with by regular fillings. If it has gone too far and it is now in the nerve, there are other procedures called root canals that can be done. And sometimes we need to cover the entire tooth with a crown to bring it back to usefulness. If your teeth are malaligned, just not aesthetically pleasing, or are causing some kind of effect on your body, then they should be straightened. Orthodontic treatment or braces simply mean moving the teeth through bone to put them in a more harmoniously pleasing position. It's important because you are moving teeth through bone, and the harmony between the joint,
Yes.
the soft tissues, and the teeth must be respected. Not respecting it can result in pain in the joint, headaches, and just a general sense of discomfort in your mouth. It's important to visit your dentist regularly and without fear, because with new technology, and we now have many new dentists in our system, where it's not difficult to get an appointment to see a dentist on a regular basis. There's always a needle, but outside of that, there's absolutely no pain.